Can you tell a child not to eat a chocolate? Of course not. If children don't eat chocolates, who will? Hum khaye. But you can tell them how to eat them, when to eat them, and what to do after you eat them. Welcome to Ashta Wellness Club. I am Dr.Sushrut Prabhudesai, and I'm going to talk about oral health for children and adolescents today. Let me tell you some interesting facts. In sweets also, there are some good sweets, there are some bad sweets, and there are some very bad sweets. In the very bad sweets come in all the candies, the hard sugar boiled candies. These candies remain in the mouth or in the cheek for a very long period of time. They secrete sugar from there and gradually begin to erode the enamel in the area of the teeth which are right next to it. So what would I prefer? I would definitely prefer a chocolate to a hard sugar boiled candy. But when should you eat this chocolate? You must eat this chocolate or tell your children to eat this chocolate not when they are going for a drive, not when you're in the cinema hall, not when you're shopping, but to be eaten at home. Even if they get a chocolate at a birthday party or if they get it when they go out shopping, you must tell them, बेटा आप ये खा सकते हो पर आप घर जाके खाओगे. इसका कारण क्या है? Because within 5 minutes of eating the chocolate, there are acids that are produced by the sugar and the bacteria in the mouth. These combination, ये एक बड़ा deadly combination होता है, sugar and oral acids. They dissolve the enamel within 5 minutes and a white spot forms on the tooth. This white spot can't be seen by the naked eye. Gradually, within a period of 72 hours, it starts becoming brown in color, and that is when a cavity begins to form. So what is my health tip to you? My health tip to you is that if you are giving your child a chocolate to eat, make sure that he or she brushes her teeth with brush and toothpaste within 5 minutes. And then your kid is safe to eat the chocolate that is his favorite. One of the biggest concerns जो आज के young adults में है मेरे लिए और मेरे जैसे parents के लिए is about the use of smoking, tobacco, and now the newest, vaping. Tobacco in any amount, even the smallest of amount, nicotine in the smallest of amount is extremely harmful to the body. This is common knowledge, but let me tell you what it does on a small microscopic level. हमारे सबके शरीर में सफ़ेद रंग की रक्तपेशियाँ रहती हैं जिनको white blood cells बोलते हैं. Did you know that the smoking actually makes these white blood cells sluggish? उनको slow बनाती हैं. Whenever there is an offending bacteria or there is a virus or there is a fungus, हमारे white blood cells जाके उसको खा जाते हैं. But smoking से इनकी एक्शन स्लो हो जाती है और वो उन तक पहुंच नहीं पाते उतने समय तक जब तक ये बैक्टीरिया और ग्रो हो जाते हैं. As a result, the healing becomes slow. Any disease becomes 10 times more severe whenever anybody smokes. I'm going to urge all my young adults, my teenagers, my adolescents who are listening to this video that please quit that habit today. There are medicines which are available which will not make you feel like smoking. These medicines are available with smoking cessation clinics. Today there are hospitals which have smoking cessation clinics. Cessation का मतलब होता है stoppage. ये clinics आपको ऐसी दवाइयाँ या ऐसी tablets दे सकते हैं जिसके कारण आप लेने के बाद में आप smoke करने की आपको इच्छा ही नहीं होगी. What can be better than that? There is one thing that is being used nowadays which people think it is very okay to use. Yes, you guessed it right. It's vaping. Vaping is where people think they can do it anywhere because there is no tobacco, there is only nicotine in it. It is better and healthier is the biggest myth I'm going to bust today. Let me tell you that vaping is actually worse than smoking. It is nicotine in a concentrated form. और इसके जो इफ़ेक्ट्स हैं ये आज नहीं समझेंगे, 10 साल के बाद समझेंगे, और तब तक ऑलरेडी बहुत लेट हो चुका होगा. Chronic obstructive pulmonary disease, tuberculosis, bronchiectasis are one of the many conditions which happen as a result of use of vaping and smoking. So please stop smoking now. Stop smoking today. Today I find that children and young adolescents don't have a healthy relationship with food. They either find food as an enemy or they find him as a very dear friend. So whenever you're upset or depressed, you'll open a bag of chips, or you'll probably eat a bar of chocolate. Or if you don't like the way your body looks, you just stop eating. You stop eating and you become what is called as anorexic. Or worse even, eat food and then put your finger in and bring the food out, which is called as bulimia. All these habits are not conducive to oral or to general health. Let me tell you what happens when a person regurgitates food. When you regurgitate, which means when you bring out or vomit out food that you have just eaten because you don't want to put calories in your stomach, you end up bringing the entire acid up from the esophagus into the oral cavity. Not only does this burn the esophagus, but it also causes dissolution of the enamel जो आपके दांतों को कोट करता है. हम इस केस को बहुत easily पकड़ लेते हैं. कैसे करते हैं हम? When we open the patient's mouth, we see कि सामने के दांतों के पीछे जरा भी enamel नहीं बचता और दांत बिल्कुल flat घिसे हुए लगते हैं. This is a classic case of vomiting or bulimia. I feel that this is a deeper issue. When you are not comfortable with who you are, how can you be comfortable with the rest of the world? The first step is to accept yourself for the way you are and who you are. And after that, you will be able to accept the world for the way it is. I urge my youngsters to not try and get into a size 0 figure and do anything damaging to your body and to your teeth. If you have a genuine acidity problem, we have mentioned in the past videos how you can use something which is called as tooth mousse, which can be applied on your teeth and bring the enamel back again to its original vigor. One more interesting fact for you to know. We all know that swimmers have great bodies, but did you know that they also have very bad teeth? They have bad teeth if they don't wear what are called as swimming guards or mouth guards. These mouth guards, they protect your teeth from the chlorine that is present in the swimming pool and the damage that it does to the enamel. Other people who should be also wearing mouth guards are people who are involved in contact sports like jiu-jitsu, boxing, taekwondo, karate, etc. One simple break of a tooth can be a very, very expensive failure for that person for the rest of his life. It can be easily avoided if you go to the dentist and make an impression who will prepare a mold for you, and on the mold there is a customized soft transparent guard that can be clipped onto the teeth before you engage in your sport. Let's talk about oral piercings, a new fad that has come from the West to our country, where people pierce beneath their tongues or their cheek or through the lips. Now you brush your teeth, you clean your tongue. Does anyone know that you also need to clean these piercings? Because if these piercings are allowed to form plaque or if food gets trapped around it, वो आपकी उन्हीं दांतों को खराब कर सकता है जिनको आपने ब्रश किया है. आपके पियर्सिंग को क्लीन करना बहुत ज़रूरी होता है. The best way to do this is with a cotton tip bud, the earbud. You dip it in a mouthwash and you clean the piercing around it. Also make sure that the piercing is made from only a surgical grade stainless steel and no other metal which is inferior to that. Take care. अगर आपको हमारा वीडियो पसंद आया and if you have gained some value addition in your life because of this, please don't forget to like it and to share it with your friends. Please subscribe to Ashta Wellness Club for more interesting information on various topics regarding your health. Thank you.